How good was that? How fantastic. Could you kind enough just to switch the lights on? See, I'm told I don't need one of these microphones. And where are my two assistants?
Oh yeah, those are out.
I've got two assistants.
Go ahead, I'll repeat your question.
There we go. Right, who's got the first question? A lady in the front here. Second row back.
Can I just explain, it's really important that you have a microphone, because although you know what your question is, not everybody will be able to hear it, and it's very important that they can. So don't start talking until you've got a microphone in your hand, and just ask them whatever you want.
Morning, Dr. Kerr. I was at the last conference as well, heard you speak there. I'm very interested in the recurrence. I was originally diagnosed with transverse myelitis in 2006. I had another attack in a different part of my spine 3 months later, which was disregarded by my then specialist. I changed specialists. She then decided it might be MS. I changed specialists to an MS specialist, told I had MS. Then I had a lot of tests, or again, MRI, etc. I'm now in a position where the specialist has told me that I have an unknown neurological condition with an unknown cause, which means I've actually gone backwards and got through 5 specialists in the process. I'm trying to find out whether it's possible that it could be recurrent TM. I was told by my specialist that it couldn't be recurrent TM because that's very rare.
So that's a difficult place to be.
It's horrible. My GP doesn't understand why I want what he calls a label.
Right.
Where do I go from here?
So, you know, that's a challenging question. I bet you many of you have been in that position in which you kind of go back and forth between diagnoses, and that is extremely uncomfortable. And I think the thing that you want most probably would be a diagnosis and to understand what's the risk of this happening again, and should I be on something to reduce that risk? It's an important question. And I can't tell you, without looking at the totality of the medical records, this is very difficult to do. I think it's important to continue that search. Until you find somebody who says, look, I take this very seriously, I know transverse myelitis, I've looked at the things that kind of predict recurrence, are willing to kind of start afresh and look at the whole thing. And keep going until you find out, because you will find specialists, many of whom will be in this room throughout the day. So, if you see a specialist, a neurologist, or a rehab doc, or a physio, hook onto them, because it's very important for people who understand this to start to think about those things. And I think you could get some assurance. I'd certainly be happy to see you at some point too. For the last years I made my move, I was not seeing patients. But I am, as of next week, I think, starting to see patients again at Harvard. So I will reopen my own Transverse Myelitis Center up at Harvard and be glad to see people. Other questions?
Next question. Lady in the front here. Just hold on, microphone.
I've got a microphone, so
There we go.
hello.
Hi.
Thank you very much for coming all this way to talk to us. I'm interested to know how far on Biogen are with the remyelinating monoclonal antibodies, and also with their new regulators, the cloud growth factor, and whether they're still very much experimental, or what the sort of time frame might be.
Okay, good. So there's 2 questions about that. One is a remyelinating approach, and that is an approach which has been in the works at Biogen for the last 7 or 8 years. And it's a specific therapy that can be given into the blood of animals and triggers a remyelination of the damaged brain and spinal cord. And it has been looked at for many, many years, and now it's in patients. Now it's in clinical trials in multiple sclerosis. And we don't know how well it's working yet. These are safety studies, but they're progressing very rapidly. And just to remember, once it gets into humans, it has to go through multiple stages of human testing so that the regulatory authorities feel that this is safe and effective before it ultimately gets approved. So that's probably a couple years away. And that is one of the therapies that we hope to bring into transverse myelitis. And Daniel Becker and I were just talking about this, that we are exploring how to do a transverse myelitis clinical trial looking at remyelination. I think it's feasible. It's challenging because transverse myelitis is much more rare than multiple sclerosis, but I think it's doable, and I think we will do it. The other one that you mentioned is new regulins or growth factors. So there are a series of growth factors that are being explored to trigger nerves to regrow. Several companies have drugs that are in the phase of clinical testing. We have one as well, which triggers nerves to regrow, we think, and to repair themselves, and may be appropriate in patients with intractable pain. Because one of the hallmarks of a persistently damaged nerve is pain. In other words, that nerve just continues to fire. That's one of the hallmarks of injury. And so growth factors that can trigger that nerve to repair itself may not only increase sensation and motor, but may decrease pain. Those two are in clinical testing, phase 2. So it's phase 1, phase 2, phase 3 approval. So we don't know if those will get to phase 3, although I suspect they will, and then approval will come probably a couple years down the road. So the point is that basically I think over the last 5 to 8 years has been an explosion of our understanding of what is the damaged nervous system and how can we pick things to treat. Those therapies initially then were 3 to 4 years in animals and safety testing, now are in humans, going towards the late stage. So over the next 2 to 4 to 5 years, you're going to see many, many new therapies approved. Not only for symptomatic therapy, but for kind of repair remyelination.
And on that line, the fluoroimmunopyridine, is that being tried in TM or?
Fluoroimmunopyridine is fanfredine. It is approved in the United States for symptomatic benefit from numbness, tingling, weakness, bowel and bladder dysfunction. For MS, it is used all the time in transverse myelitis. Even though it's not approved, it's off-label. It was not approved in the EU. So this is something in which the EU felt that the perceived benefit was not important enough.
Is that being, I'm on 3/4 immunopyridine and can't
3/4?
Yeah, and can't get it anymore since it's got its orphan drug status. And I was wondering if the appeal in the European.
Yes, so we're still trying to get it approved in Europe. I think it's very important. Don't know if it's going to work, but I think it's an important drug. For those of you who don't know, it can be effective in some. It's not a magical cure-all. Some people don't have a benefit from it, but some people have a significant benefit. We hope to get it approved.
The lady with a hand up there, and after that, I'll take one in the front and see if we can get them lined up. Okay, please, fire
Hello,
away.
good morning. I'd like to ask what your thoughts are on the effects of nutrition. You've obviously touched on vitamin D supplements. My situation is that I started in 1994 and I only received the diagnosis 2 years ago of transverse myelitis. And within those 15 years of no diagnosis, I took a nutritional approach, and I have had 5 relapses from recovery to pretty much normal to then relapsing 5 times, and obviously no imaging to support that, but just from the clinical symptoms I knew that there was obviously something going on, and it seems that nutrition has really helped me to recover, and I'm just wondering what your thoughts are on the nutritional side.
Yeah, I think that nutritional approaches are important, but there's so much we don't know. It's hard to say, what would be appropriate nutritional strategies for one person, whether that would work for another. I think, I encourage everybody to take an individual approach, try things that they think works for them in terms of nutritional strategies. There are overarching principles such as, calcium and vitamin D and high fiber. These types of things are very important in the context of transverse myelitis. There's a lot of experimental therapies out there, nutritional therapies as well, with huge claims of benefit, and those are probably worthwhile to be skeptical of. I certainly have seen nothing, nutritionally that is kind of a cure or does some of the things that they may be posited to do. So I think some skepticism, but I think also taking a very proactive approach and trying to figure out what works for you is the way to approach that.
Could I just add
Yeah.
on to that? You mentioned vitamin D.
Right.
Is it too late ever to start taking it?
No, never too late to start taking it.
So you need to go to the doctor, have a test.
Yeah, simple blood test, and it's very easy. What you want if you have to take supplementation is D3. That's the active one. Vitamin D2 is okay, but it needs to be converted by sunlight into vitamin D3, so it's a little bit challenging in certain climates. So might as well just get the D3. It's already activated.
So there you go. Straight down to the chemist later. Question in the front here.
I'm asking this question actually on behalf of Christina Ferrer, who's here from Barcelona. And you'll understand why I'm standing up and you're seeing me when I ask the question. Christina asks, if I get pregnant, is there any chance of another bout of TM? She has TM already.
Okay, good question. During pregnancy, almost certainly no. And in all likelihood, transverse myelitis doesn't recur anyway. So chances are, even after the baby is born, no. But in multiple sclerosis, it's well known that during pregnancy, MS activity goes way down. The reason is that a pregnant woman is kind of immunosuppressed in a way so as to not reject the baby, which is genetically not identical to her. And so in MS, after the baby is born, attacks can occur. So I have not seen that type of thing occur in transverse myelitis, where there are attacks after the baby is born. But that is a slightly increased risk period, not during pregnancy, but after pregnancy. So it would be the kind of thing that you would not do anything about, but you would just notify your treating physician to take a look and keep an eye out for this after the baby is born. And if symptoms started to develop, you might do a quick course of IV steroids just to prevent that from coming on, but unlikely.
Does that answer your question? Okay. I had the second part of the question
Two
actually.
questions.
The second part.
That's a usurping privilege.
Do you think it will have a negative impact on her TM?
Would pregnancy have a negative impact on the transverse myelitis? Not at all. Not at all. I think people after transverse myelitis are scared to get pregnant, and it depends to some degree on the severity of the injury. But in most cases, pregnancy can go completely normally. If there is some weakness of pelvic muscles, it would make delivery itself challenging. It might increase the risk of a cesarean section. You'd want to be with a very good obstetrician who's aware of this, because the muscular contraction to have the baby delivered may not be there, but it can happen. You can do it, you just have to be under the right care.
Sounds that's a thumbs up.
Oh yeah.
Right, I think we've got time for one more question right at the very back.
Hello, good morning. Thank you very much for your talk. You mentioned on one of your slides the contributing factors to transverse myelitis, and you said that 15% of those that suffered from TM received vaccinations. I wondered if you could just drill down a little bit further and maybe just expound on that, what vaccinations were deemed to be the contributing factor.
Yeah, so it's tough to kind of go to know for sure what the relationship is, but we looked at a large number, and the relationship had to be a vaccine within essentially 30 days. I think, if you go beyond 30 days, I mean, you go say 90 days or 6 months, most people have had a vaccine in that period, whether it's a yearly flu vaccine. And so it's hard to start to make a relationship between whether that vaccine contributed in any way to the transverse myelitis. We still don't know the answer to that. It wasn't a specific vaccine. In other words, we don't think that there's a high-risk vaccine that's lurking out there that one should avoid. In fact, if you look at the numbers, in Europe, also in the United States, you find that they're overwhelmingly safe, 99.999% safe. And so, but it could be flu, it could be diphtheria, pertussis, tetanus, it could be, in some cases, it was rabies. It wasn't a specific vaccine. And, you know, I think the best answer is that they are very, very safe. People should get vaccines, especially once you've had transverse myelitis, because, for example, the flu kills 30,000 people a year. And if somebody has a transverse myelitis and has trouble breathing, it is more likely to be a very severe influenza than it would be for a healthy individual. So I don't think there's any hard evidence that vaccines cause transverse myelitis. I know some of you may differ with me on that. And in general, unless there's somebody who's absolutely convinced that a vaccine triggered their transverse myelitis, I say go ahead with vaccines.
So you go so far as to say that if people who've got transverse myelitis, not really a worry?
No, I think really you should be more inclined to get vaccines in that case, because the diseases that they are protecting you from would be likely to be more severe in you than in somebody who has not had transverse myelitis.
That's great. We do have one more question. One more question. Lady in the front in purple.
Good morning, Dr. Kerr. I actually came out to Baltimore a few years ago. I think you ran a conference, TM and MS, together, and did manage to find exactly what I had. Because at some stage nobody really knew if it's TM or MS. There seems to be, they're all very much like cousins, excuse me. On the reoccurrence side, I find that each time I do have a reoccurrence, I can get myself back from a wheelchair to walking, but each time you are becoming weaker and weaker. Is that known that it's getting harder to fight it and each attack can be more severe than the last?
Yeah, that's true. I mean, essentially the way to think about it is, you have all of these wires up and down your spinal cord, and we have some extras in there that are kind of in reserve that we don't really need. But each time there's a relapse, a couple more of them may be injured. And so you may be getting closer and closer to where you need everything you got. So the reason that's important is if you are having ongoing exacerbations or relapses, you need to know that even though you come back, that there's probably some injury that occurs with each attack that doesn't come all the way back. And so you need to be really aggressive in trying to figure out how to stop those recurrences. And really define, are they, in some cases it's not a true recurrence, but people get a cold, they get an upper respiratory tract infection or a pneumonia or a urinary tract infection, and they feel much worse thereafter, right? That's probably not a true exacerbation. That's not a true repeat attack of the spinal cord. You just feel lousy. And people who have had transverse myelitis feel lousy after other things have occurred, like colds and pneumonias and things like that. But you need to try to distinguish that from a true recurrent attack of the spinal cord. And the ways to do that would be to really get an examination, a neurologic examination if you can, maybe a repeat lumbar puncture, repeat an MRI, because if any of those show conclusively, no, this is not just a cold that I had, this is a true recurrent attack, you really want to be on some therapy to head those off. And that's important because you don't want to keep kind of losing a little bit each time you have another attack.
Right, ladies and gentlemen, there is going to be, we have at 11:45, we've got 3/4 of an hour for questions with all our speakers. So I appreciate there's lots that need to be asked, but there will be more time. Ladies and gentlemen, I think we got the conference off to a tremendous start with Doug. He is an absolute star. A little something for you. Thank you. We will be hearing from Doug later. We'll have questions, and he's talking about stem cells later on. Just before we break for coffee, a few little points. Thank you so much for wearing your name badges. Please carry on doing so. If you haven't collected them, there are still some for collection after reception. Don't forget to visit the exhibition, which is on the right-hand side of the main lounge. There are things in there. Take your credit cards with you. There are things I believe you can even buy. And importantly, from our point of view, at reception, there is a list of all delegates. And we would ask you, if you would like us to keep in touch with you, could you please go and put your correct email address down? Write it clearly, because it may well be that we're not communicating with you because we don't have your latest email address. So we need 190 email addresses. A few other points. Don't forget there are some individual sessions. Farshita is organising some sessions on walk and gait. There's one at 11:15 today and one at 10 o'clock. Barbara Badcock is talking about staying positive and taking control, which I think is so important. Those are today, 1:45 on the hour, 1:45 the hour. And finally, in order to put on the weekend, the Society has dug deep into its reserves. In order to try and get some of that little bit of reserve back for the charity, we're holding a raffle. The prizes you can see is alcohol. There are chocolates out there, and we will be coming around. People will be selling raffle tickets. I would ask you please to be generous and dig deep. All the money is being retained by the TMS Society and will be used for your benefit. We now have half an hour for teas and coffees, which are available outside. Just hold a minute. Rob's got a question.
You mentioned Barbara Badcock and Bashu. They're on tomorrow, aren't they?
No, Barbara is on today, I think I'm right. The workshop is on today, Barbara's on today, and Fashida is on today and tomorrow.
According to this, Barbara's on tomorrow.
Well, if you go, she's speaking tomorrow. She's speaking tomorrow, but she's also holding workshops.
Oh, she's doing a work
today. Yes, individual workshops today. Details are in reception if you want them. Half an hour, ladies and gentlemen, please be back to seats.